Hey there, I'm Dr. Charis Chambers, and I know what Auntie, Mama, and even your friends might have told you, but super heavy bleeding and extreme cramping are not normal signs of a period. Not only is this not normal, but in many instances, these symptoms are actually because of uterine fibroids. I know many of you have heard of them, and some of you may have even been diagnosed with them, but it's time we had some real talk about them. Let's start with exactly what they are. Fibroids are abnormal growths of cells from the muscle layer of the uterus that affect you depending on size and their location. They are non-cancerous tumors, and they do not always cause symptoms, which is probably why many people don't take them seriously at first. They can cause heavy bleeding, painful cramps, excessive bloating, fullness, back pain, frequent urination, and can even be linked to reproductive issues like multiple miscarriages, infertility, and early labor. Researchers aren't even sure what causes them, but what we do know is Black women are at a higher risk, and 80% will have them by age 50. Black women also tend to develop a greater number of fibroids that are larger in size, associated with more symptoms, and occur at a younger age. The rate of hospitalization for fibroids is 3 times higher for Black women. Now, the reasons for the increased risk of fibroids in Black women are not well understood, but what we do know is Black Americans have lower levels of vitamin D, and studies suggest that low vitamin D can increase the likelihood of developing fibroids. Black women also have higher rates of obesity, which is also a risk factor for fibroids, as well as high blood pressure and family history. There are many treatment options available, including medications and surgeries. Surgeries include myomectomy, which is removal of the fibroids while keeping the uterus in place, or a hysterectomy, which is the removal of the uterus as well as the fibroid. So what should you do if your doctor tells you you've got uterine fibroids? First of all, know your power and use it. Too many women don't feel comfortable or empowered enough to make decisions about what to do about fibroids. That's why I'm getting real and giving you real information to help make the real difference for you and your care and treatment. Here are some of the first questions you should ask your doctor. What is the size and location? You have every right to request your medical records, so ask to see your ultrasound report. Number 2, encourage your doctor to build out next steps and explain them to you in a way that you understand, rather than just giving you information and moving on. Number 3, ask this critical question. Is there something else that you may not be offering me that another doctor or specialist would? Statistics show that Black women are given hysterectomies as treatments for fibroids at a higher rate than white women. It is possible that some of these hysterectomies are not necessary or were presented as their only option. It is so important for you to make informed decisions about your next steps before you get to extreme anemia or extreme pain, because then you're forced to make urgent decisions. And we all know urgent decisions are often not the best ones for the long term. You've got to think beyond the moment and consider things like future fertility desires. Are you going to want to have children later? This is a serious consideration that needs to be a part of the discussion with your doctor to determine the best treatment option for you. Remember, physicians may be the experts in medicine, but you're the expert on your body. Uterine fibroids are preventing a lot of us from living our best lives, but that doesn't have to be the case. Be empowered, be informed, and be well.